Pandemic is still raging. Over 119,000 Americans have died, and cases are still rising in 29 states with over 20,000 new infections per day. In fact, 12 states set records for the most daily cases in the past week. And we know that Black, Latinx, and Native Americans are bearing a disproportionate burden of the administration's failures to address this pandemic. Meanwhile, the Trump administration seems to have moved on. The last time the White House task force held a full press briefing was April 27th, and the task force is now winding down. Admiral Jawad is stepping down as the administration's testing czar, despite the fact that we still need to greatly expand testing. We still don't have enough tests. We still don't have enough PPE. We don't have a vaccine. And this fall, we could see another wave of infections. Yet, President Trump last month declared, and I quote, "We have met the moment and we have prevailed." Dr. Fauci, do you believe we have prevailed? Has the fight against COVID-19 been won?
I wouldn't use the word prevail. I would say that we are still in the middle of a serious outbreak. There's no doubt about that.
Instead of devoting his time and effort to taking this pandemic seriously, President Trump is hosting campaign rallies, packing thousands of people tightly together without masks, in direct opposition to the guidance of all public health experts, just so that he can hear the crowds chant his name. Clearly, this president has decided the best strategy to deal with the greatest threat against this country during his presidency is to bury his head in the sand and wish it went away. Dr. Redfield, as the director of the CDC, your advice to the president is important now more than ever. Dr. Redfield, when was the last time you spoke to the president about the country's response to this pandemic?
Thank you, Congresswoman. As I mentioned before, the interactions and discussions I have with the president, I'll keep to myself, but I do meet with the task force.
Dr. Redfield, I'm not asking for the content of your conversation. I'm asking when you talked to him last. Has it been a week, a day, a month?
Again, I'm going to stay with my same answer, that I continue to talk with the task force whenever the task force meets. And I think...
Thank you, Dr. Redfield. I think the fact that you won't tell this committee when the last time you spoke to him, whether it was days or months ago, is a real concern. Dr. Fauci, when is the last time you spoke to the president?
About 2.5 weeks ago.
Thank you, Dr. Fauci. Admiral Jawad, when is the last time you spoke to the president?
It was about 2.5 weeks ago as well, maybe 3 weeks ago. If you don't mind just me clarifying, because I do think it's really important, I'm remaining the testing lead. A lot got misconstrued because I said I was not going to be 100% of the time at FEMA, because my current position also works on ending HIV substance use. So I'm still going to maintain the testing lead, but I am also integrating back into some of my other office functions.
Thank you for clarifying that. Honorable Han, when is the last time you spoke to the president about the pandemic's response and the response?
It's been some time since I spoke about the pandemic response. I did have a conversation in the last couple of weeks.
Would you say that it had been more than a month ago?
No, ma'am.
Okay. Dr. Fauci, you've been candid in the past about the shortcomings of the federal government's response and what more is needed. Dr. Fauci, as painful as this spring's shutdowns have been, if we don't put in the effort now, expand testing, prepare for a second wave, develop national strategies for contact tracing and vaccinations, could we see our progress reversed? And could we be forced to shut down again if cases again get out of control?
In describing what's going on, it's a very complicated situation and a mixed bag. There are certain parts of the country, certain areas, cities, states that have actually done very well and are following the guidelines that we put together. The Gateway, Phase 1, Phase 2, Phase 3. New York City is one of them. Actually, Washington, D.C. is another. There are other areas, other states, other cities that have not done so well. I have a considerable concern about those because I want to make sure that we get everything under control. It is not there yet. I hope as the weeks and months go by, we will be able to do what you're referring to and mobilize the identification, isolation, and contact tracing in those states, the ones that have recently been in the news: Florida, Arizona, Texas, and those states that are now having a serious problem. So it really is a mixed bag. We have some doing really well and some really in trouble.
Right, but Dr. Factor, just to clarify, in the areas where it may get out of control, we certainly know there are states that are doing that now, would you say that we might have to go backwards and some of the progress may be taken away and we may have to shut down?
Yeah, I wouldn't necessarily, first of all, I agree with what you're saying. I wouldn't necessarily say an absolute shutdown, lockdown.
Right.
But if someone is going from gateway to phase 1 to phase 2, and they get into trouble in phase 2, they may need to go back to phase 1. I don't think they necessarily need to go back to lockdown.
Thank you all. With that, I yield back.